Sally, and today we'll be talking about the 6 steps to parotidectomy. So first of all, I want to give credit to Dr. Mehra, one of the greatest head and neck surgeons in the world. He's the one who taught me these steps, drilled them into me back when I was in surgical residency at Yale. So step 1, first you make your modified Blair incision, go down, up, and kind of go down onto the neck. You always want to have the neck ready in case you want to do a neck dissection. Step 2, you got to raise the flap. So you go down basically to the level of the parotid fascia here, down here to the level of the great auricular nerve. The great auricular nerve, not the great auric, the great auricular nerve. And you lift it up to the level of the masseter. So you're lifting up the skin, the subcutaneous tissue to that level. 3, you lift the tail of the parotid, you separate it from the sternocleidomastoid muscle, and that muscle, you know, the name tells you where it is. So you separate the tail off the sternocleidomastoid. Sometimes you get that anterior branch of the great auricular nerve, so just be careful for that. You can repair it if you need be, but ideally you're able to raise it up and kind of displace it posteriorly. Then step 4, you find the digastric muscle, posterior belly. Find it, you can kind of dissect it back posteriorly. Then step 5, usually with you basically need to skeletonize the tragus, the tragal cartilage, and get down to the tragal pointer. So you can do that by putting a finger in the ear with a double pronged skin hook as well for counter traction, and dissect down with a jake or a snap or whatever you want. Then step 5, very easy, you connect the tunnel you made here when you skeletonize the tragus, and you connect that to the tunnel you made here when you were dissecting out the digastric. So now you've had this nice open plane along the entire lateral border of the parotid. Finally, the fun part, very carefully, now that you have this plane exposed, dissect slowly, slowly. Of course, no muscle relaxants. Usually you have facial nerve monitors on, but you go down to the exit of the facial nerve, you know, right outside the stylomastoid foramen before it starts to branch at the pes. But you basically find the main branch, the main trunk of the nerve, and then slowly take your time and dissect it out. Once you dissect it out, parotid should come right out easily as you do that, and that's it. Then you close. Personally, I prefer to close with a running locking suture, very, very similar to how I would close a facelift nowadays. All right, hope this helped. The 6 steps to a parotidectomy, remember them next time you're in the OR.